One of the things I've learned from public health is that the way to make some progress is to have friends and colleagues and partners. And those partners can be people that you work with or people out in the community. And because we all want to do what we can to contribute to make people's health and lives better. So I would just say, remember that.
This episode is sponsored by TherapyNotes, therapynotes.com. Be sure and check them out and be sure and use the promo code Gordon, Gordon, and you can try them out for 2 months for free. Over 15 years ago, when I started my private practice, I had to learn a lot, and most of it the hard way, and I don't think you need to do the same. Hi, I'm Gordon Brewer, a licensed psychotherapist, and welcome to the Practice of Therapy podcast, part of the Psychcraft network of podcasts. Join me in this journey of discovery as we have conversations with other leaders and professionals in both the mental and allied health fields. Join us as we explore both the business and clinical sides of running a private practice. And welcome to the podcast. This is episode number 325 of the Practice of Therapy podcast. I'm Gordon Brewer, and so glad you've joined us. And if this is your first time listening in, glad you found us. Hope you'll take time to follow us or subscribe to the podcast wherever you might be listening to it. So in today's episode, or in this episode rather, I had the pleasure of talking with Dr. Jan Carney, who is the Associate Dean for Public Health and Health Policy at Larner College of Medicine at the University of Vermont. She had also served as Vermont's Commissioner of Health under 3 different administrations within that state. But what is fun about this conversation is that we just kind of delve into the importance of health information and talking about how do you get good health information and just how we can maybe integrate a little bit more holistic approach with how we think about what we do as clinicians. So looking forward to you hearing my conversation with Dr. Carney. It was an honor to get to speak to her and just get her insights into all of this. But before we get to that, one of the things I'd like to invite you to do is you've heard me mention on the podcast before a project I've been working on with my good friend Ashley, who has put together a website called mentalhealthwaretn.com, where she is putting together a lot of what I like to call swag items for those of us in our professions, but also just to make people more aware of mental health and mental health needs. And so I invite you to go check it out. Just go over to mentalhealthwaretn.com and check it out and see all the cool stuff she's got there. Really trying to help her out in promoting this and getting the word out. And one of the things that she can do is if there's an idea you have about a design or want something personalized, she can do that as well. And so, just be sure and check it out. And also, before we get to my conversation with Dr. Carney, I'd love for you to hear more about the Psychcraft Network and one of the members there, along with information from our sponsor of the podcast, TherapyNotes.
Hey there, I'm Chris McDonald, and if you don't know me yet, I'm host of the Holistic Counseling Podcast, which is for therapists who want to deepen their knowledge of holistic modalities and build their practice with confidence. The Holistic Counseling Podcast is proudly part of the Psychcraft Podcast Network, a network of podcasts focused on helping people live more meaningful and productive lives. Join me each week as we explore the best practices for integrating holistic approaches into therapy and delve into the many benefits. Whether you're looking for new techniques or seeking to deepen your own personal journey towards wellness, this podcast is the perfect companion for your holistic path. If you haven't listened yet, you can find it over at holisticcounselingpodcast.com. and discover other resources, including products, books, and other trainings to help support you in your holistic journey.
Have you ever wished your private practice could run as smoothly as a well-oiled machine? Well, look no further, because TherapyNotes is here to revolutionize your practice. TherapyNotes is the complete practice management system you've been dreaming of. With everything you need to manage patient records, schedule appointments, meet with clients remotely, create rich documentation, and handle insurance billing, it's your secret weapon for a smoother practice. And the best part? It's accessible wherever and whenever you need it. Yep, even on the go. Imagine having more time for what truly matters, your clients. It's like having an extra set of hands, but digital. And here's the kicker. It's the very EHR Gordon relies on in his own practice. So, you know it's the real deal. Say goodbye to paperwork nightmares and hello to more time and better quality care. Check out TherapyNotes today at practiceoftherapy.com/therapynotes. Oh, and don't forget to use the promo code GORDON to get 2 months free. That's practiceoftherapy.com/therapynotes with the promo code GORDON. Enjoy the show.
Well, hello and welcome again to the podcast. And I'm really happy for you to get to know today Dr. Jan Carney. Welcome, Jan. Glad you're here.
Thank you very much. I'm delighted to be here.
Yes. And Jan, I'll let you tell folks a little bit more about yourself. But what I've learned so far is that Dr. Carney is in Vermont, and she teaches at the medical school at the University of Vermont, and particularly in the area of public health. So as I start with everyone, tell folks a little bit more about yourself and how you've landed where you've landed.
I'm here at the University of Vermont, Larner College of Medicine, and I'm a professor of medicine. I'm the Associate Dean for Public Health and Health Policy, and I'm the chief of our division of public health here. And we do a lot. I've been in my career, my background is trained in internal medicine. I'm an internal medicine specialist, and I'm also a preventive medicine specialist. I went back and got a degree in public health. I was our state's health commissioner for 3 different governors, and have a lot of experience in public health practice. Here, I do a lot of teaching and research. I absolutely love students and love being curious about new things we can do to help people here here in Vermont and anywhere else. And I think public health and that intersection between the clinical world and public health practice, I think there are more opportunities to talk about how that can help people, and whether that's people in communities or people in clinical practice. And I look forward to doing that with you.
Well, I think this is a great topic, because I know as you're speaking about this, I think about, how public health or just our health in general has really risen to the top of the pile, so to speak. Particularly, unfortunately, I don't know that we could ever say we're out of the COVID pandemic, but we're coming out of that. I think people became much more aware. And then particularly for this audience, the folks, most of the people listening to this, is how that affects mental health and just that sort of thing. But in your work and just learning how to communicate with the public more about health issues, what are you learning and what are you finding that works?
One of the challenges was, and we saw that really clearly in the pandemic, was all the health information that was just wrong. It was inaccurate, misinformation. And so what that made us do was think a little bit about are there ways we can do a better job or help provide resources both to general public and to people who are seeing patients, as an example of where to direct people for really high quality, evidence-based information so that they can improve their health and really eliminate the risk to harm themselves, which is definitely a concern with some of the unproven therapies.
Yes, there's just a lot. You're right. There's a lot of misinformation out there. What do you think it's important for people to know about how do we communicate? One thing in particular, sorry, I'm jumping around here, but one thing in particular I think about for our professions in the mental health fields is that people have different ideas about what it means to come to therapy. And also, just I know one particular issue that comes up is that with medications, I think a lot of people shy away from it because they feel like, okay, it's going to hurt me or it's going to create problems. So, yeah. So what are you learning about all of that?
Well, I think that I look for things that in my work, what are some practical things? Everybody's too busy. And so when we do things both in our work or just looking for information when we're home, we do things that are convenient and fast, right? So
Hmm.
I think about, are there things that we can, you know, websites, for example, to give people about high quality sources. And my
Hmm.
favorite is medlineplus.gov.
Hmm.
And if you
Okay.
just and people Google things. And so one of the skills I think is really important is to begin to be intentional and deliberate about, if you Google a topic, how do you know if that's really good information or bad information and
Yeah.
something that you really don't want to trust? And so medlineplus.gov is a great place to start. It has medications, health topics, and the whole key is that it also can give you some skills of how to determine if the information you're finding that is trustworthy from a
Yeah.
scientific and medical point of view. So,
Hmm.
who's saying it? When did they say it? If there's no date, maybe be a little careful there. And
Hmm.
then how do they know, or really what evidence are they giving you that you should trust it? Are they mentioning any scientific studies? Is the person who's telling you this have a background or have a reason that you should believe them? And so be more discriminating. Some of the big university websites generally are a good place to go. Many of the government websites have links and easy to read materials and in different languages and are culturally appropriate. And we're finding more of that there. But I would start with it medlineplus.gov. And from there you can go through a little module about how to do this better. And if you're in the
Hmm.
office setting and you see patients, perhaps it's a good thing to give them some of these resources because everyone just very conveniently might go to social media or just Google something. So, I mean, I
Yeah.
would start with something like that.
Okay, that's great advice because I think a lot of us in this profession we have websites and we like to have resources on our website that are accurate, and
Mhm.
so yeah, I think that's an important piece. So, well, to switch gears a little bit, I'm interested and curious to know how you moved into public health as opposed to the traditional clinical work
Yep.
and what how you see that's important for everyone.
So I trained originally as an internal medicine physician. I finished my residency and I went to a conference and there was something about, we didn't really have public health in medical school, and we had a little bit of epidemiology, part of the training for that. But there was a conference I went to that began to show some of the science and the data of how you prevent disease and improve health in entire populations. So I was very curious, ended up going to public health school and get my master's in public health. And then in that process, that was kind of my aha moment from education because I realized that as a clinician, I learned about all the different approaches that we could use to diagnose and treat people one at a time. And that was great.
Hmm.
And
Hmm.
critically important, the importance of our advice is paramount. And in addition to that, there's evidence-based approaches to how we prevent disease and illness in entire populations. And that whole science of populations and prevention of disease and illness in those populations I became fascinated with. So after I got my degree, I decided I wanted to try that full time. And my first position here was as the Deputy Commissioner of Health for the Vermont Department of Health, our statewide Department of Health. And then within a year, I became the health commissioner, and I served almost 14 years.
Wow.
And where, we did an awful lot of work. People are most familiar with public health after the pandemic about the work of epidemiologists, and they've heard about vaccines, but there's a whole broad range of activities of public health to ensure the conditions that people can be healthy that health departments do. We worked very closely with doctors, nurses, school nurses, all kinds of people in our communities. And then since that, since I've been here, and I've been here almost about 20 years now, and that educational piece, and how do we bring that education out to more students, to more health professionals, to more people trying to do research, because we know that we need a lot more people working in public health. We also know that the skills of public health can be extraordinarily helpful to clinicians in practice to who are interested in making their patients better.
Yeah. So here's a big question for you. What do you see as our biggest public health concerns currently?
Like right now?
Yeah.
I think we have a lot of ones. I wouldn't say I would say number 1, 2, 3. I'd say I have a list, and part of it depends on your perspective. If it's in your local community, and you can look at the data in your own community. There's public websites to do that, and I share those all the time. And for a state or a country, I think that we continue to struggle with basic access to healthcare for everyone in our country. And I see it here in Vermont, and we have rural disparities. And it's much harder for people in rural settings. And in some ways, that's logical. When in the bad weather here, the roads are bad, and you might have to travel further, and there may not be as many people in clinical practice for you to see. And there's lots of different barriers. And those might be, some of them are general, and some of them are unique to your specific location. And I think that place really matters about people's health. And I think we're learning that more and more. The role of our neighborhoods, our access to health and social services. So social determinants of health is very high on my list. And, basic, having enough food to eat, housing. Basic access to primary and preventative care. All these things remain very challenging in many communities, and especially in our rural communities. I would say mental health right now is a huge issue, and for different reasons in different ages. I think that the isolation that people felt, we still haven't recovered from that. And the young people who were in school remotely and are now learning a different way to make social connections. I think there's a big literature on the importance of our social connections as you get older, and particularly for older adults. But one thing the pandemic taught me was that those social connections are just so important for everybody of all ages. So mental health is up there. So I would say those would be some of the top on my list.
Right. Yeah. And I know as we were chatting about here before we started recording, I know here in my area of the country, here in the Appalachian region, particularly Eastern Kentucky and Southwest Virginia, and here in East Tennessee, the access to healthcare is a challenge. I mean, I have even in my own practice, we have folks that come to us will drive 50 miles or more to just come to here to our practice. And then and just having worked, one of the things that I did previously was I was part of an organization called Episcopal Appalachian Ministries. I'm one of the hats I wear is I'm an Episcopal clergy person, and so we really dealt with the poverty issue in the Appalachian region and just access to things, and also people knowing how to access things
Right.
is a huge problem, I think, for a lot of people. And then we didn't even touch on this, just the whole opioid epidemic,
Yes.
particularly in our area, but it's all over the country,
Yep.
I'm sure.
Same.
And just, being able to address those issues and how do we do that? That's a huge, wish we had the easy button.
Yeah, it's not. No, and all those things, yes. And in our area, we're experiencing similar things. And
Mhm.
one of the things that we've been talking about, a couple things in our work, which is, that communicating health information to people in a way that they want to receive it. And we found
Yeah.
some differences in the rural and less rural areas. And people like word of mouth. You think about the faith communities in local areas, think
Hmm.
about town papers. So being very conscious of and asking people, if you need health information, or just, where would you like to see it, or how should we talk to you, or how should we present that material, and just little things like that done, on a regular basis, I think can help a lot.
Right, right. Can you give some examples of that?
Yeah.
Yeah.
So we're doing a project. We're finishing a project now and we actually looked, it was part of an NIH grant, and we looked at COVID testing during the pandemic, and we talked to people about, and we did focus groups and interviews. So we had conversations about really what were the things that were helpful and got in the way, so that we would learn for both for any future public health crisis, but also to give us a better glimpse into how to reach the most rural, underserved, vulnerable communities. And we did this in northern New England. And so one of the groups of older adults we were talking to wanted to have health information in one-page flyers with cartoons and large font, and not on the internet, and making sure that we incorporated information from our own health department here. To me, that was really important. So give us that feedback. And so what we've been trying to do is develop health information materials for different groups that sort of start with ask people what they want and where they're
Hmm.
at. And instead of assuming that a university or a government organization or health department or even a health professional should give health information in the same way for everyone, but we can be very specific about that. So we're learning quite a lot about that, and I think we're going to try and do a lot more to try and improve health literacy, one community at a time.
Yeah. Yeah. Yeah, that's interesting because I think, yeah, you look at the differences in generational ways of learning
Right.
stuff, you know, I can think of several examples of people caring for older adults and
Yeah.
maybe some resistance that they get, just because they hear things through conversations in the community that's just misinformation.
Yeah,
Yeah.
exactly. So, I mean, so we're working on that, and that's part of the
Mhm.
whole, I would say, public, if we could help people access high quality health information and bring more of that, is that going to solve the problem of not having enough people to see, clinicians to see in rural areas? No. Is it
Mhm.
one piece of something that might help? Yes. And
Mhm.
another area that we're looking at is the use of community health workers or lay health advisors or people who are not doctors or nurses as people who can help link people to services. And that's something that's been demonstrated to be very effective in areas of, for example, cancer screening and in different communities, and getting that and educational materials can help people get into preventative care. So some of these, I think we have to be creative.
Yeah, yeah, yeah. This is fascinating, stuff, and I think I know for a lot of us in this field, the mental health fields and the allied health fields, being able to be better advocates for things, I think is good. I think it's a good idea. I know that's something that we've been working on in our practice is just having a kind of a database of resources for people.
Yeah.
And so I think that's something that I think we can help each other with. I think being able to connect with people locally and find out, okay, when you have a patient that has this particular problem, who do you refer them to, or how do you help them find those things? And so I think those are important. Maybe a way to think about it is just being able to be better data and resource collectors in our areas. Yeah. Well, that's good. That's good. Well, Jan, I appreciate you. I've got to be respectful of your time, and I think this was a great conversation that probably we need to continue on with. But tell any parting thoughts that you have for the folks that might be listening.
I think that sometimes sort of the health issues we talked about, the opioid crisis, the mental health issues, the access to care, all the different health issues that we're seeing, and the basic health and social needs of people in our communities can seem overwhelming. I would say one of the things I've learned from public health is that the way to make some progress is to have friends and colleagues and partners. And those partners can be people that you work with or people out in the community. And because we all want to do what we can to contribute to make people's health and lives better. So I would just say, remember that. And in the challenging times, do what we can to have a sense of optimism that we share with every person that we come into contact with.
Right. Right. Yeah, I totally agree. Yeah, I think the more we can focus on our communities and being able to connect with people in positive ways is just going to make a bigger impact. I know something we were talking about, I can't remember if it was before we started recording or not, but I think one of the things with mental health that is so important are the relationships we forge. But that theme has come up several times this week for me in just listening to other podcasts and just things that I've been, kind of reading is that the happiest people are those that are connected socially and have good relationships with other people.
Yeah.
And they also tend to be healthier people as well.
That's right. Absolutely.
Yeah. Yes, that's great. Well, Jan, how can folks get in touch with you if they want to connect?
They can email me. And I'm on LinkedIn.
Okay.
And they can message me there, and happy to help provide any of those resources. One of the things I do is run the graduate public health programs here, and we do everything we can to help provide high quality evidence-based resources to the public and also to all of our colleagues, professional colleagues.
All right. Thanks for being on the podcast, and hopefully we'll have another conversation before long. Well, a big thanks to Dr. Carney for joining me on the podcast, and I hope you found this our conversation interesting, and I think there's a lot for us to think about, and just being able to advocate for our clients, but also just making sure that we're getting good information about things. I think a lot of times we can maybe take information for granted and not getting stuff that we know is sound and really based on some true research. Just unfortunately with the world we live in, there's just a lot of misinformation that gets put out there. So I hope this was just a reminder for you to just do your due diligence, as they say, in making sure your information and what you communicate to folks is accurate. Also, glad you've joined us. Thanks for being part of this journey with me. One of the things I would encourage you to do is go over and check out the website, practiceoftherapy.com. Got lots of resources there, lots of things going on. And also check out my friend Ashley's website, Mental Health Wear TN, and find out more about those items that might be fun for you. So go check it out. And also a big thanks to the sponsor of the podcast, TherapyNotes. They are the leading electronic health record system for mental health providers. They're who I use in my practice and absolutely couldn't operate without them. And I'm always impressed of all the new things that they're coming out with. They have really added to their library of assessments. Was just looking at that the other day with my staff. And it's a pretty impressive list there that you can find helpful in doing your intakes and that sort of thing. Also, they've got a patient portal that is really second to none as far as all the different things that they keep adding to that. And one of the things most recently is secure HIPAA compliant messaging that you can do with your clients, where you can send them a message and it goes through their text and it is HIPAA secure. So pretty cool little thing that they've got there. So be sure and check them out, practiceoftherapy.com/therapynotes. And be sure and use that promo code, just Gordon, Gordon, and you can try them for 2 months for free. So be sure and check them out. So take care, folks. Looking forward to being with you in the next episode. It's hard to believe we're in April already. It seems like the first quarter of the year just flew by. And looking forward to the springtime, and it's already starting to get that way, although we're getting snow flurries today. So I guess it's not quite there yet. But anyway, take care, folks, and do take time to follow us or subscribe to the podcast wherever you might listen to it. You've been listening to the Practice of Therapy podcast with Gordon Brewer, part of the PsychCraft network of podcasts. You can find out more about the other great podcasts in the network by visiting psychcraftnetwork.com. And if you haven't done so already, please visit us at practiceoftherapy.com and get your free private practice startup guide, along with a lot of other great resources and webinars and free things just by visiting. Also, be sure to follow us wherever you might be listening to your podcasts. This podcast is intended to be educational in purpose and is not intended to give legal, accounting, or counseling advice. If you need a professional, find the right person for that.